This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Mike Sedita.
Hello out there. Welcome to episode 58 of the Good Neighbor Podcast. My name is Mike Sedita, and we are joined today by Dr. Armin Deukmejian of NeuSpine in Lakeland. How are you doing, Dr. Duke?
Very good, Mike. How are you today?
I am excellent. There hasn't been any rain yet today. It's due probably in about an hour or two. So we're early afternoon here today, and we're recording. But we will hopefully today get our usual bout of torrential downpours. So if you happen to hear what sounds like thunder, that is not rain. That is Norman, who is in the filler there on the podcast, under my desk snoring tremendously, shakes the whole room. So don't let that scare you off. You're a surgeon. I don't think it will.
No, I am a fan of bulldogs, though. So I approve of that.
We will definitely get into your fandom of bulldogs. Let me just tell you briefly a little bit about the Good Neighbor Podcast. So in 2020, when COVID was rampant, a gentleman by the name of Charlie McDermott down in Southwest Florida said, hey, let me create the Good Neighbor Podcast so businesses, doctors, lawyers, veterinarians could get their business out into the community so people knew they existed, knew what they had going on, whether it was professionally or philanthropically. And essentially over the last 3 years, the Good Neighbor Podcast is now national. We're in cities from Atlanta to Virginia and so on. And I'm the person here in the Tampa market. And when I say Tampa loosely, obviously that's the metro area. You're kind of right in between Tampa and Orlando that gets to talk to business owners every day about what they have going on. So with that in mind, tell us a little bit about NeuSpine Institute.
Sure, absolutely. First off, congratulations on the success of the podcast. That's tremendous.
Trying our best every day.
So NeuSpine Institute is a neurosurgery, pain management, physical therapy. We sort of encompass everything. I'm a neurosurgeon, and I started this practice with my partner, Amir Ahmadian, back in October of 2017. And we essentially take care of patients that have all sorts of neurosurgical problems, or even actually the vast majority of the people that we take care of at NeuSpine Institute are just people that have neck pain and back pain. So they don't have to have some type of complex neurosurgical problem. It's really treating neck pain and back pain, and essentially trying to take care of them from, the beginning of the neck pain till the resolution of the neck or back pain. And oftentimes that can be treated non-surgically. And that's what we try to focus on, is really non-surgical treatments, but we have all aspect of treatment.
So your garden variety client, is there an age range that is it older people that are kind of just like arthritic and things have kind of set in? Or is there a whole segment of your patient population that is younger that might have like an accident or something that's kind of gotten them to the state where they need to see you?
That's a great question, Mike. And to be honest, it's really all patients. We generally try to see patients that are 18 and above. Occasionally we'll see, someone in their early teens, but the vast majority of our patients are 18 and older. We don't do too much pediatric neurosurgery, but I'd say that probably the bulk of our patients are, 40s and above, but there are plenty of patients that are involved in some type of a car accident or a slip and fall accident that don't have to fall in that age range, that have a new onset of pain, and they come and see us. And I think a lot of times people get nervous about going to see a neurosurgeon, right? Because they think, well, I don't want surgery, so I'm not going to go see a neurosurgeon. And in reality, I'm sort of the quarterback of the patient's care. So someone will come and see me, and I'll say, hey, look, let's get an MRI. If it's necessary, MRI or X-rays, we'll get some imaging. And if the imaging shows something that absolutely needs surgery, well, then we have that conversation. But the majority of the time, the imaging doesn't show something that needs surgery. And I'm most of the time telling patients, hey, look, let's make surgery your last resort. Let's try X, Y, and Z first. And then if that fails, then we can think about a surgical option.
So when you say X, Y, and Z, now, the elephant in the room is, and it's a big stigma in Florida, especially, some of those X, Y, and Z treatments are pain management, whether that's medication or like, I don't know if epidural is the right word,
Yes.
but back injections and things like that. And you walk through, you do the evaluation, and whatever is the proper course of action, you guys are like a one-stop shop for those patients.
100%. That's correct. So they'll usually see myself or my partner or one of there's 5 neurosurgeons within our group now.
Oh, wow.
And if let's just say, Mike, you developed back pain and you didn't have any x-rays or MRIs and you wanted to schedule an appointment. And that's a very common theme in patients that we see. You'd get scheduled to see one of the nurse practitioners or PAs. They would do an evaluation. Then we'd order imaging. We get the imaging. When you come back with the MRI or x-rays, then you would see one of myself or my partner. Then we would say, hey, look, I don't think you need surgery, but what we should do is we should try physical therapy, right? And do a course of physical therapy and see if that helps, or even a back brace for back pain can really help significantly. And then if that doesn't work, oftentimes, like you mentioned, a pain management doctor, and that's its own field. So we have pain management doctors within our group. Over in Lakeland, we have Dr. Weinberg is our pain doctor in Lakeland. And, they have a whole bag of tricks that they can utilize. What they try not to do is they try not to just dispense medications.
Yeah.
We don't like to go down that road. They want to do more interventional pain management.
It's funny is we went from a period of time when that was kind of the standard operating procedure. I mean, not everybody, obviously, but it became such a problem that now there are people with, like, my dad is 80 and he needed a pain management doctor at one point, and just the level of hoops that we had to jump through, because now it is so regulated, really, for the protection of the people, but also for the protection of the doctors. I mean, so many things that are going on. There's so many people out there that are try to work the system, that it makes it hard for the people that legitimately are struggling with some pain, and it makes it harder. It ties, your guys' hands a little bit as well.
Yeah, that's a great point. That's a great point. And we see it all the time. I bet. The vast majority of the patients that we treat, we do a pretty good job of trying to weed out the patients that are there for the wrong reasons. I mean, we really want patients that want to get better, that are not there just for pain medications. And most of the time, our pain doctors, they're fantastic. They can treat the patients and get them out of the pain, or at least on some type of regular schedule of, let's say, an injection every year, or a nerve ablation, which is a type of procedure that they do every year. And their pain is controlled, right? And then 12 months later, they have to come in, do the procedure again. But in our surgical patients, especially when we do surgery, we're handcuffed on what we can give patients post-operatively to try to get their pain controlled when they go home. And it's, they're paying the price for a few bad apples, I would say.
Right. It's funny is, so side note to the conversation is that I have, and people are watching this, they won't see it, but you can see I have a scar here on my neck.
I was going to ask.
Yeah. So I had I guess it's a disectomy done right before I turned 50. So they didn't need to do a fusion, which was great. Didn't know you guys existed at the time. However, I ended up using a different surgeon in Sarasota. And for me, what was the funny thing is, I was having pain when I would go to the gym. I couldn't even curl a 10-pound dumbbell in my left hand. It was a couple of reps and I just couldn't maintain that grip in my hand. So I went to an orthopedic surgeon, figuring it was something with my elbow or my shoulder or all this other stuff. And ironically, a guy that I work out with, who's like 6'2", 290-pound gorilla bodybuilder guy. And he said, look, I'm going to tell you right now, go see a neurosurgeon. I know it sounds scary, exactly what you said. Go see a neurosurgeon, let him do a scan and figure out what's going on. He goes, I would bet you any amount of money you have some type of impingement in your neck that is causing everything to go down your arm and causing the problem.
Smart guy.
And sure enough, they did the scan, and something about, like, you'll understand this. I mean, some people might as well, but when the skull sits on your spine, there's like a curvature in the base of your neck, right? Like right in that area where your Adam's apple is, it's supposed to have some sort of curvature where your head, where your skull sits. Well, I don't have a pronounced curvature. It's fairly straight. And essentially I had a compression and I had a bone spur that was hanging down that did require surgical intervention. And when I tell you, Doc, in the normal recovery process, it ended up taking me about 4 months. I had a couple little setbacks, but after about 4 months, I went back to the gym and I have, knock on wood, not had any issues since. There's no issue. I was able to regain muscle building. So neurosurgery, while it might sound scary to people that are listening, finding the right place that can identify the problem and take you through the steps, it was definitely the way it worked for me. I'm a testament to it. And I have full range of motion in my neck, all that stuff. So it's great.
Well, I would say a few things about that. I think that your gorilla friend is a smart guy. He diagnosed you.
I'm not going to tell him that, but I have alluded to it.
Please don't tell him I called him a gorilla. That was your word. So
I understand. You're clear. Don't worry about it.
He's a smart guy. I mean, he diagnosed you perfectly, right? You had probably had a disc herniation with a disc osteophyte, and basically that your spine is made up of individual bones that kind of sit on top of each other with an intervening disc, and the disc is like a jelly donut almost, and sometimes the jelly can kind of pop back towards the nerves. And that's usually what happens, especially a young guy like you that's active. It happens regularly. The good news, it sounds like, is that the pressure on the nerve wasn't there long enough to allow muscles to atrophy, because you're able to you regained your muscle mass. So whatever it was healed once the pressure was removed off of the disc. So that's
I definitely caught it pretty quick. And then the other thing, at one point in my life, maybe like 10, I had a motorcycle accident on my 30th birthday, which is kind of what kind of started the ball rolling. Probably some of your best patients, and no pun intended, probably some of your best patients is people who ride motorcycles. But I had a problem in my lower back too, and I ended up using like a spinal cord stimulator for a long time, for a few years, until I wasn't getting the result that I wanted from it, and ultimately had it removed. Is that procedures that you guys do as well? Like, I think I had like a Nevro was the brand that I had. But I'm sure there's a whole bunch of different brands for that, right?
Absolutely. And it's interesting because we do, again, when I say we do pretty much everything that's necessary with regards to the brain, the spine. There's every aspect of that kind of treatment we do at NeuSpine Institute. And so, that's what we wanted. That's what we set out to accomplish when we started the practice is, hey, we want a one-stop shop for people. We don't want primary care doctors who are seeing their patients. We don't want them to worry, well, should I send to the neurosurgeon? Should I not send to the neurosurgeon?
Right.
So, we want to take that onus off of them, and, neck pain, back pain, headache, whatever it is, we take care of it. And what we usually do for spinal cord stimulators. So for your audience, what that is it's essentially an implanted device that goes along your spinal cord, and you have almost like a little battery pack that the purpose of it is to essentially trick your brain into thinking that there is less pain below where we put the electrode than there may be, right? Because if you stub your toe, you have pain nerve receptors in your toe, and those pain pathways travel up the spinal cord to the brain, and the brain receives that as a pain signal. And then you say, ow, right? And you move your toe. Well, if you dampen that response with an electrode, which is what you had, you dampen that pain response. So anything below that, which would have been for you, your low back, you don't register it as much pain. And I don't know if you still have it or not, but what we usually reserve those for are people that we can't identify a source of pain and potentially try to treat that source, whether it's with surgery or with, ablations or injections, epidural steroid injections, like you said. So, or it's somebody that has had multiple surgeries and that they just can't find the pain relief that they want. It's a great last resort option.
And it's funny you say that. I had gone through all those. I mean, I tried the ablation, I tried the epidural, I tried all that stuff similar to that. Was actually in Atlanta when I had some of that stuff done. But ultimately, and ironically enough, the same guy who diagnosed my neck pain, he gave me a different workout regimen that included hot yoga, and the combination of the way I was training with weights and now resistance bands alleviated the pain enough where I stopped charging the stimulator to see if it could, because I could always recharge it if I wanted to. I let it kind of go dead and see if I could manage it the way he was suggesting. And again, it seemed to work itself out. So I'm pretty fortunate in that regard with his with some of his remedies that I've tried. So
yeah, that's great. And I think that, you know, stretching, yoga, that's all very important. Core strengthening. Our physical therapy department really works to focus on strengthening the core, because then it'll alleviate a lot of the stress that your muscles in your low back have, which can cause muscle spasms and back pain.
So let me ask you this. I mean, your journey, I mean, you personally, were you always interested in the medical field as a young man? I mean, or, you know, did you maybe want to be a podiatrist and then ended up going into neurosurgery? Like, what was your path to get you to here where you and Amir are partners?
Sure. Yeah. So I grew up in Southern California, and my father was a OBGYN. So growing up, I always had that influence. My mom was a nurse. So I kind of always had in the back of my mind, I wanted to do medicine. Went to college, didn't really know exactly what I wanted to do, kind of strayed from medicine. And then towards the end of college, I said, you know what, I think I want to go to medical school. I went not knowing what I wanted to do, whether it was primary care. I was pretty sure I didn't want to do podiatry. Not a big fan of
feet.
Not take anything away from podiatrists. Yeah. They do great work, but it wasn't for me. And eventually I realized, you know, I like working with my hands. I feel like I have good hands. I'm detail oriented. So I thought surgery is probably the best route for me. I just didn't know what type. And then my brother is also a neurosurgeon here in Florida. And I said, well, I can't let my brother get the better of me. So I got to go ahead and do neurosurgery.
Older brother or younger brother?
He's an older brother.
You got to keep up. Yeah, you got to keep up. And how many years apart are you guys? How competitive was it your whole life?
We're about 8 years apart.
All right. So it's not neck and neck, like a couple years apart.
Right.
So you kind of followed in the footsteps. And when you strayed a little bit during college, what did you think you were you going to be a musician in a rock band? Like what were you going to stray off to do?
I mean, it wasn't anything that drastic. That would have been cool. I don't play any instruments, unfortunately. I wish I did. But no, you know, I didn't know. I thought maybe finance, maybe computers. Gotcha. I went to college in San Diego, you know, a college that was pretty focused on biology, engineering. So I just didn't know. But let's just say I had a good time in college, and you know, kind of leave it at that.
Many of us do. Yes, I totally got it. So how do you get from college out in California, growing up in Southern California? What makes you just like throw a dart at a board and say, you know, Lakeland, Tampa, Metro, Central Florida, and go?
You know, not really. I mean, I had a more guided path, if you will. So what happens after college, if you go to medical school, I ended up going to medical school. I got a master's before I went to medical school at Georgetown University. So I was up in Washington, D.C. Then I went to medical school at George Washington, which is also up in Washington, D.C. So what happens in your fourth year, which is your last year of medical school, is you pick a specialty or whatever you want to do. And during that year, you kind of interview around at different programs. So I went around, interviewed maybe 15 to 20 different neurosurgery programs throughout the country. Then you rank them and they rank you. And on a special day called match day, you match it, whichever your highest rank is that ranked you the highest. So it's some kind of computer algorithm. So you don't really know until match day where you're going to go. So I ended up matching here at University of South Florida here in Tampa, where I did my residency. And, you know, fortunately it was near the top of, I think it was either my first or second choice. Now, the reason I did rank it high is because my brother had started his practice here. He did his training here in Gainesville, and I was fully planning on going to UCLA for residency. But then I have two sisters, and they ended up moving out here. So I'm like, what am I going to do? Go out to Southern California by myself? No.
Right.
So I wanted to be near my family. So Tampa was at the top of my list, and did 7 years of residency after that, and met my beautiful wife. And she wanted to stay in Tampa. I wanted to think about going somewhere else. So we compromised and we stayed in Tampa.
Sounds like a typical marriage.
Well,
so,
you know.
I will point out, I don't want to point out and brag about my understanding of the medical field, but I have watched Grey's Anatomy, so I am very familiar with the matching process.
I mean, I don't know if you need a job, but we need another surgeon. It sounds like you're well trained.
Clearly, I know all the terminology. So now, how about your folks? Are they still with us? Are they traveling around the country from staying in California and coming out here? Have they transplanted over to here as well? Where are they at?
So my father died when I was 10. So when I was young, so he passed away. That's okay. My mom lived in San Diego until about 5 years ago, and she's now moved out here. She didn't want to give it up. I mean, it's just gorgeous out there.
Yeah.
But we're all out here now, so we finally convinced her to move out. So she's out here.
And then the bulldog thing that we talked about earlier, is that because of Georgetown?
Partly, my sister Tara, she's a attorney out in Melbourne, and her husband, they have a bulldog, and he's just awesome. I mean, they're just so fun and big and burly, and I just love them. I think they're playful and great.
You and your wife, do you guys have kids?
We do. I have a son, Roman. He's 8 years old, and my daughter, Alexandria. She's 6. We got 2 dogs, 2 kids, and I couldn't be happier.
And no bulldogs, though. 2 dogs, but no bulldogs.
No bulldogs. No.
They are expensive. You need to be a surgeon. I'm not a surgeon, so I'm struggling. But you need to, between the shortened palate, the pushed in nose, the breathing, the snoring, all that stuff. But I wouldn't trade him for the world. I've had bulldogs for over 20 years. He's my 7th. Well, he's my 6th. I had one more after him. Yeah. But they really are. I mean, they're great with kids. I mean,
Absolutely.
A lot of that stuff is how the environment you keep them in. But Norman's main activity is sleeping and eating. So beyond that, he's really just, he plays for about 6 minutes a night and he's exhausted, and that's the end of it. So we just kind of roll with it. So, we talked a lot about the different stuff you do professionally. When you are not in the office, what do you guys do for fun? The kids are 6 and 8, so they're at an age where they're doing a lot of fun activities. Are they in the medical mindset as well, or are they playing baseball and soccer and all the different stuff that goes along with it?
Yeah, they're just enjoying being kids. We're not pushing them in one direction or the other. They're fantastic kids. They're really they're great. So we do a lot of we try to do a lot of outdoor activities. We go to Utah pretty regularly. And I like to mountain bike out there. We'll ski, I snowboard. My kids are skiing. So we just, sometimes, especially this time of year in Florida, it's a little challenging to do anything outside that's not water related.
Like breathing. Yeah.
Without getting bitten by bugs. And so, anything that we can do outside, we try to do. I think that just being in the mountain air, I mean, coming from Southern California, Utah really reminds me of that, that mountainous landscape. So I love it out there.
Yeah, that's one thing we definitely don't get a lot of in Central Florida. Up here by me in Wesley Chapel, you can go to Dade City or Zephyrhills and get a little bit of that topography, but generally, it's the flatness of Florida that we all kind of deal with, and the beaches. And you're right, it's ridiculous. This time of year, the rest, like for me, the thing about Florida that makes it appealing is like October 1st through April 30th, you just can't beat it. The weather's great. I mean, it might be a little hot here and there, but can't beat it. But from June 1st until September 30th, it is like you're either going to go outside and sweat, like it's so hot that you sweat through your clothes, or you get torrential downpours, which is coming down, every afternoon. So,
and I think that, and I've been here now since 2007, and I wouldn't trade it. I mean, I love it here. I like being able to visit other places, but I love it here. And obviously, I'm sure you've seen it in your neck of the woods. A lot of people love it here too. People are moving into Tampa in droves, and all the surrounding areas are just growing up like crazy. And so, which is why we decided, hey, look, if we're going to try to provide this kind of practice where we can enable people with back pain and neck pain, we want to put different offices all around because Tampa's growing. So, we have our Lakeland office, we have our Wesley Chapel office, we have an office in Zephyrhills, Brandon, and Trinity. And so, now as well as Brooksville. So we're sort of trying to get the surrounding area because people are just moving in and trying to give them the best care that we can.
So now in each one of those locations, are they office locations and you operate with like privileges at certain surgical facilities, or is everything, if I go to Wesley Chapel where I am I going to see you or Dr. Amir, or is it going to be like other doctors you have on staff, and is everything done there, or do I then have to go to a surgical center or something?
Yeah, great question. I'm in Wesley Chapel right now as well. So I'm at our Wesley Chapel office location. This is this was our first location, and this is sort of our home base, if you will.
Gotcha.
But all of the other offices, except for Brooksville, have the ability. They have a pain management doctor and a neurosurgeon that covers the office, as well as physical therapy. Excuse me. And so the offices that I cover myself, Wesley Chapel, Brandon, and I just pulled out of Trinity. Dr. Saleh is one of my partners, and he covers our Zephyrhills and Lakeland office.
Okay.
Amir Ahmadi and my partner also covers Brandon and Wesley Chapel. And we have two other neurosurgeons that are our newest additions to our group, Dr. Hatefi and Dr. Gelsomino. They cover Trinity and Brooksville. So we're
all right. So you guys kind of have it covered, and like, oh, you have like overlap, like redundancy. There's a couple people in each location, so you could go to Salt Lake City, you go to Utah, or do whatever you're going to do, and you have coverage, which is good.
Well, we're actually looking, interestingly, we're looking at possibly putting an office somewhere out in Utah as well at some point. I know it's kind of far, but it's something we're looking at. And then just to get back to your question about where we do surgery. So yeah, I have privileges at most hospitals in the Tampa area. I mean, Advent Wesley is sort of where we do a lot of the our hospital cases. We have a surgery center that we work out of as well. That's over in Trinity, Odessa area. But I'm also privileged at, Tampa General, Brandon Regional. We're in the midst of getting privileged. We're at Baycare, so St. Joe's, North, Trinity Hospital, Regional Medical Center, Bayonet Point. So really, I mean, we cover all the hospitals, and we're all privileged there, so we can kind of cover each other and help each other out.
Well, so the nice thing about that, I mean, from a patient standpoint, is a patient has choices. Like, some facilities, some surgeons will say, hey, listen, I only have privileges at Tampa General. Right. And you could be in Wesley Chapel, and it's like, hey, you're out of luck unless you're going to go get this surgery done in Tampa. So that is a really nice bonus through your, through NeuSpine, because now if I live in Brooksville, I can, the center is relatively close. There might not be a center right there, but if you have privileges at all these facilities, it makes it a lot easier for your patient.
Yeah, and I mean, that was one of Amir and I's goal when we started out was, hey, look, we can make one office and make everybody come to us, and you may have to drive an hour and a half or something like that, or we can have a few different locations, so you make it easier for patients. So we want to try to create this concierge style practice where it's a little easier for patients.
So let me ask you, not to get specific though, I mean, do you live in the Wesley Chapel area and are driving down to Brandon, or like, do you live in Zephyrhills? Like, are you in this general vicinity?
I live in South Tampa. I've lived there since I did residency at Tampa General Hospital. My partner lives in Carrollwood.
Okay.
But I mean, it's so easy now with, veterans with 275.
Yeah, you can shoot right up.
You just shoot right up. It's really not hard to get anywhere. And, I can listen to a good podcast like yours on the way.
It's so funny. I lived in Atlanta for a long time, and I lived on the north side of Atlanta, and geographically, the airport from my house, in theory, was like a 45-minute ride. But in Atlanta, that 45-minute ride is like an hour and 30 plus if you have to go through the city. And then Atlanta airport was crazy. So when they talked about like international flights, you have to be here 2 hours before. The traffic was so bad there. I'm leaving for a 9 a.m. flight at like 5 a.m. just because I don't know what I'm going to run into going through. But here it's not so bad. You can go from South Tampa, jump on 275 straight up, and you're in Wesley Chapel, or up to Veterans, and you're right at Trinity. That's pretty great.
And our airport is fantastic too. I mean, not to compare it to Atlanta's, but no offense. No. And my partner is from Atlanta as well. I can't stand the Atlanta airport, so I love the Tampa airport. It makes traveling so easy.
So as we start to wind this up, if there's anyone, I mean, we talked about a lot of cool things. I mean, the fact that you guys handle everything from beginning to end with an ailment when it comes to the spine and the back and the neck, that's number one. Number two is the convenience and location of convenience of multiple locations and surgical privileges in all these different places. If there's one thing people need to take away from this, what do you want them to, to really resonate when they're thinking about, coming to NeuSpine or getting checked out or whatever they need to do?
Well, I think the, two main things are that you're in good hands with us. We'll always, we have your best interest. We're always going to take care of you. We're going to make surgery your last resort. We're going to try to get you through this pain flare up without a surgical intervention. And the other thing is you don't have to have gone through, months of dealing with the pain before you come and see somebody. You can come and see us, if you have this severe or a pain exacerbation or a flare up and you just want to get checked out, that's fine. You come and see us with that. We'll give you, even if you don't want surgery, and that's totally fine, we will give you an honest opinion about what we think is going on and try to get you on the pathway to getting better.
And I guess the last question really is, you guys have locations all over the place, but what is the point of entry? If I have back pain today and I need to get to you, is there a single point of contact? Is it a phone number, email, website? How do I figure out what's the best way to get to where I need to be?
Yeah. And our operators and our schedulers are trained. So if you, for example, had back pain in Wesley Chapel, they're going to schedule you for an appointment at our closest office, which will be Wesley Chapel. And so you can either do that online at NeuSpineInstitute.com. That's NeuSpine Institute.com. Or our phone number is 813-333-1186. And that's all you need really to get plugged in.
Awesome. Guys, if you're listening to this and you're starting to have some back pain, you think you're having some trouble, and you just kind of want to get it identified, go to NeuSpineInstitute.com. It's NeuSpine Institute.com, or call Dr. Duke's office directly, 813-333-1186. Dr. Duke, thank you so much for being on the Good Neighbor podcast. We really appreciated having you on.
Thanks for having me, Mike, and keep up the good work. You guys are doing a great job.
Thank you. Have a great day.
You too.
Thanks for listening to the Good Neighbor Podcast Passcode. To nominate your favorite local businesses to be featured on the show, go to gnppasscode.com. That's gnppasscode.com, or call 813-922-3610.